powered and sponsored by AARP. There is a discussion going on, and we thought at rolling out that it was very important that we get subject matter experts who have their pulse and their commitment and desire to serve our community in health disparities and bring fact versus fiction. This will not be fake news. These are real practitioners, real doctors. So joining me today is Dr. Sandra Brown. She hails from Louisiana. She's not serving any gumbo today, but we truly are proud. She is definitely on the task force to eliminate health disparities, and we really appreciate all that she does because it is not easy. It will be a long journey. So for all of you looking for a COVID vacation, you are at home. That is your COVID vacation location. So for next, I have a wonderful dear friend of mine. She is Dr. Gloster, and she is very famous for all of what she knows and what she's done for this community. She hails out of the DMV, and that is in Maryland. And last but not least, the famous Dr. Norma L. Day Vines. How are you ladies doing tonight?
Fantastic. How are
Welcome to
you?
Health IQ. Let's increase the Health IQ. So, for all those parents who are sending children off to college, and all those parents who have little ones that are going back, and those who are attending virtually, what would be the first two things that you would want them to share with each of their children? I guess with all of their children at some point. We're going to start with you, Dr. Gloster.
Yep. So thank you for having each of us to share in this really incredible topic this evening. I really feel honored to have the opportunity to speak on behalf of the thousands of students and parents and principals and community members who have chosen to embark upon this journey with us as public school educators, even in some private institutions. This is certainly a unique time in our lives. And a lot of times you oftentimes hear people say, you know, this is our new normal, right? And I certainly don't subscribe to that. There's nothing normal about what we are experiencing at this time. I like to refer to this as a new era in education, right? Like we won't allow this crisis to go to waste. And so we'll use this opportunity to be creative, to be collaborative, and really think about how we can prioritize the safety and well-being of our students. I very much, you know, am an educator by trade for over 20 years, but my very first and most important job is a mother, right? I have a 10-year-old embarking upon fifth grade, and I have a 5-year-old embarking upon kindergarten this year. So I too share the sentiments of all of the parents and all of the educators. I have a very unique lens. I get to look on both sides. I would say to parents first, to just breathe. It's going to be okay. Trust that our educators are really looking at building frameworks and expectations to ensure the safety of each of your students. Whether your school district chose to embark upon a virtual learning opportunity where, you know, we're using devices and engaging via Zoom or some other technological platform, or if you're in a hybrid or a face-to-face opportunity. Those pieces are in place at many of the schools across our country. My current school district is focusing on virtual learning. And because I have the lens of a mother as a parent, right, it's been easy for me to build not easy, but just it's easier for me to build the framework focusing on the best needs of our students. So really thinking about the technological pieces, how we can provide technology across the city, and partnering with folks such as Comcast and others to ensure that possibility, thinking about their safety, thinking about how we can engage parents and using schools as a hub to support their learning. So while there's a ton to think about, I would just encourage parents just to breathe, and make sure that you set some consistent opportunities at home for your children so that their experience in this new era of education is as consistent as we can possibly make it.
Dr. Gloster. You are
Sir.
definitely an educator. You're definitely an educator. Dr. Brown?
Hello, everyone. Thank you for having me. And I am honored to share this panel with such an esteemed group of sisters. I come from the South, so I bring greetings to you from Southern University in Baton Rouge, Louisiana. I serve as the Dean of the College of Nursing and Allied Health. Southern University is the largest HBCU system and the only system in the United States. So I bring greetings to you from SU. I also serve as the co-chair of the Louisiana COVID-19 Health Equity Task Force. And this was a task force that was appointed by our governor, John Bel Edwards, early in April when the numbers were soaring in Louisiana. At that time, we had a 60 to 70% death rate among African Americans in the state of Louisiana dying from COVID when our population is only 30 to 32% African Americans. So he heard our call and he appointed a task force of subject matter experts from across the state of Louisiana to address health equity and health disparities. We have good gumbo here, we have good ambiance here, but one of the things that that Louisiana ranks is 49th as one of the least healthiest states in the United States. So when COVID-19 hit, we were faced with a bright light shining on Louisiana, and it certainly had an impact on the health and welfare of our citizens who were already impacted by poor health outcomes. So our initiative is to look at health equity and to reduce health disparities, and hopefully to come out of this pandemic stronger, better positioned. I like to think that we have three pandemics going on right now. We have an economic pandemic, we have a physiologic pandemic from the COVID health issue, and we have a sociologic pandemic due to racial injustices that are occurring throughout our United States. And all three of these pandemics are coalescing at the same time, which also puts a burden on our school system and our structure. I agree with Dr. Gloster, who states that it's a time where we can exhale, but it is a time for us to call to action, because even though we want to be done with COVID, COVID is not done with us. So we have to make some real action-oriented steps to making sure that our students are getting the education that they need, a world-class education, whether it's in the classroom or at home.
I do long pauses, ladies. And thank you so much, Dr. Brown. If you would, Dr. Davines, chime in and share as we set the tone for this evening, Health IQ. We really want to hear from you as well.
So thank you. I'm honored to be on this panel as well tonight. Thank you for the invitation. The first thing I want to say is that I'm a parent of an 18-year-old who's a freshman in college, and I'm going to share with you what I shared with her. Well, she's starting her sophomore year. But one of the things I told her is that there's a lot that we don't know about COVID. Rates are spiking. Going back to college may be a dangerous proposition. Going back to college is not necessarily about your education. It's about mitigating financial losses in many, though certainly not all cases. And my concern was not so much what would happen on campus, but what would happen if she were struck with COVID. And when we think about health disparities, we think about the disproportionate rate of people that are getting COVID, the fact that in many places there may not be enough beds to go around, the fact that there are many students who are not social distancing. If you read in the Chronicle of Higher Education, every day there's a long list of universities where students are violating policies and causing rates to spike. We saw earlier this week where UNC Chapel Hill closed, North Carolina State University closed, and a litany of other campuses closed in light of the pandemic. One of the things that I reminded her of is Rana Zoe Mungeon. She was one of the first people that we heard about during the crisis. She was infected with the disease, and she was denied entrance to a hospital 3 times. She presented to the hospital the first time with a fever and shortness of breath and severe headaches, and they sent her home from the hospital, and they gave her albuterol. The second time she was taken to the hospital by the ambulance, and she was, because of shortness of breath, and she was told that she was having a panic attack, and she was subsequently sent home. It was a third time that she was admitted to the hospital, but at that point it was too late. Her symptoms had advanced significantly, and they could not save her life. And so when I think about the notion of anti-Blackness and the fact that medical practitioners are going to have to make life and death decisions about who gets oxygen, who gets a bed, who gets a ventilator, who gets treatment. When we know historically about how we've been treated, these are things that you have to think about. So that has been my sort of daily mantra to her in terms of thinking about her health and well-being, and recognizing the fact that some of this is financially motivated.
Y'all was so deep, and I got real sad. I mean, it is emotional. I mean, I think I've the story that you've told, I think I've probably interviewed in the beginning 10 individuals. One, we did a story called The Angel of Death.
Mm-hmm.
And he literally saw them taking people out of the ICU each day wrapped up in cellophane, and that he believed the angel of death came and spoke to him, and he told him, just give him oxygen. He would leave. He didn't even want to be there but he was rejected 3 times and decided that, he told his sister to take him somewhere else where they had fewer people. So it's a sad story, a sad tale. But when you think about enrollment and you think about the fact that we're really trying to do distance learning, I just want to know from each of you, what's at risk if parents don't participate? Like, I think this is, if there's any time that parents have to participate, or their lack of participation, their lack of even parenting skills. So we may not be giving them enough skills, or they may not have enough skills. What about that level of service? Because to me, that's I'm not worried about, I shouldn't say this, but I'm going to say it. I'm not worried about Superintendent Gloster's child. I'm not worried about, when I say worry, I pray for your children, but I know you got your hands on the clay. You know what I mean? Clay is not wilding out. And if they start wilding, there's somebody conscious there. But our community, it's a real challenge. What's at risk? What can be lost if the parents don't have the skill sets and aren't supported? Dr. Brown?
Well, I can tell you this from personal experiences and dealing with the population that we have at Southern University. The large majority of our students are first generation college graduates. And so that, being a first of anything, there's hopes and dreams there. So you have multi-generational families living in one home that are trying to make ends meet and still try to give their sons or daughters or grandsons and granddaughters some type of quality education. And so that puts a certain amount of burden. Wanting to send your loved one to college, hoping it's a safe environment, and you're investing these hopes and dreams that they will get a college education that you could not. There's a thing that we've studied long and hard. I've dedicated a lot of my life to looking at health disparities. And it goes back to zip codes. And I don't know if it impacts you all, in the parts of the country where you all are, but in Louisiana, if you tell us where your zip code is, we can tell you how healthy you are. We can tell you what's in your neighborhood, what's not in your neighborhood. Zip code is more important than your genetic code. because it tells you how healthy you are going to be because of the resources you have around you. So where somebody lives shouldn't determine whether they live. And so that's where we're trying to channel a lot of our efforts and energy to those zip code areas that are vulnerable and marginalized, both economically and health-wise, because we're seeing a pattern now. There was a study that was just completed last week here in the Baton Rouge area, and 60% of the people that they tested for COVID were positive and asymptomatic. And so that's worrisome, because if you've got 60% of all the people that were tested showed no symptoms, then they are at an opportunity to infect others because they don't know that they have the infection. So that's a challenge for us on the college campuses, making sure that we're doing frequent testing. We've set up COVID testing stations for the staff, for the faculty, for the students, and we're going to be doing it continuously because we want to capture those students who may be positive early so that we can isolate them from the larger community.
Dr. Gloster?
So I was really processing the question, this notion of what's at risk, particularly for our families. I currently serve as the assistant superintendent in the school district of the city of York, and we are an urban school district in Pennsylvania. And we serve about 6,200 students. And what we recognize about our community, very similar to what my colleague was speaking about moments ago, is that we really have to be familiar and sensitive with the needs of our families and our students, and the extent to which that our families, connecting back to your original question, how are our parents and families really able to support their students and their children in this virtual learning space, right? And so like I received an email maybe Thursday or Friday of last week from a parent who said, you know, I understand the district decided to go into a virtual learning space, but I work 2 jobs. I have 3 children. Who's going to help my students while I am working? That is a real concept for a lot of our parents. You know, whether we're in urban spaces or not, but particularly in our community. And so what we've been able to do as practitioners is really think through how can we leverage our schools to serve as community hubs for our community and our parents. And so one of the things that we have planned to do each week, 1 day a week, instead of the virtual learning happening that day, we are having each school serve as a community hub. So each day, there are chunks of time, 3 hours at a time, from maybe 8 in the morning until 7 p.m. Parents can come in, they can make appointments, and we'll have community partners there from communities and schools. We'll have our school social workers there, our school counselors there. We'll have faith-based folks there to support us if they need help with food resources, housing. We'll be hosting parenting courses, just on, you know, language acquisition or how to help your student learning in this virtual learning space. We'll have technology support, both hardware and software. So we're really trying to think through the scope of which we can serve the community in this virtual learning space, because we do realize and recognize that, again, this is a new era in education. And so we don't want to compromise the students' opportunities to engage in this partnership with our teachers in their learning space. And likewise, we also want to be able to leverage our expertise and our partnerships with our communities to support our students. So it really is an opportunity for us to think about, you know, how do we serve the whole child and the whole community? And this village concept is really where this idea came from. And so it is our expectation that our parents will take advantage of that, so that the students will be able to leverage that learning in the virtual learning space. We're also thinking about using that hub even for having parents to have drop-off centers throughout the course of the week if they have to work those 2 or 3 jobs at a time, so that they won't compromise their ability to provide for their family, and likewise students being at risk of not being able to participate in that. But as I've shared with our staff, one of the other pieces as we think about this notion of being equitable educators is ensuring that we provide those devices for the students. No longer are, devices, laptops, iPads, or the likes, an opportunity or something like a nice to have. Our laptops and our devices really do serve similar to what we knew as textbooks. It is a must have for our students, right? And so it's our duty and responsibility to put things in place to make sure that our students have access to that so that they can leverage this virtual learning opportunities that are in place to support their health and safety, and not coming into the physical building, but being able to leverage the learning in a virtual space.
Thank you.
Mm-hmm.
Dr. Davines?
I think it's a beautiful thing, Dr. Gloster, that schools are really doing a lot to address the stress that families have and recognize all the challenges and move beyond just understanding or sort of speaking to children's cognitive needs. My background is in counselor education. I'm Associate Dean for Faculty Development at Johns Hopkins University, but I'm also on the faculty in the counseling program. And so one of the things we think about frequently is mental health. And right after COVID started, Kaiser Family Health did a study. And one of the things I found is that basically the less income you made, the more stress you were under, and it compromised your mental health. And so when we think about what's going on in a number of school districts, families, low wealth families are really struggling to provide their children the needs and the supports, food, shelter, clothing. Even if they have technology, do they have a strong connection to the technology? And even among college students, we're seeing some of the stressors that people are having in terms of, yes, a faculty member trying to conduct a Zoom session, but they're also trying to monitor children who are learning. In low wealth families, there may be one computer for four people. So who gets priority? Having to take care of children. I have a colleague that is that has a young child, and both she and her husband are working, but they can't put their child in daycare because their child has health needs. Mm-hmm. And so that exacerbates the stress that people are under in terms of trying to manage in COVID. But with that said, I think I just want to say it's beautiful that many school districts are reaching out to try to fill in the gap, to stand in the gap for families that may be struggling. I think that there will be a heightened level of PTSD once we get out of the pandemic, given the volume of people. We haven't grieved as a nation. And when we think about the fact that there are 160,000 people that have died, and when we think about the residual effects of that, so for every person that died, how many family members are involved? How is that impacting people? How will this impact people's ability to go back to work? How will this impact people's ability to leave home, to have a sense of well-being, safety, security? All of these things sort of impact education and the educational experience.
I don't know. I think I'm not certain that we have a goal set as a community on what we're going to require of ourselves moving forward. I think about KPIs in education. And a friend of mine, Dr. Ian Smith, talks about this being a reset. Mm-hmm. And we talk about reset in health. Any asymptomatic person at this moment just has decided not to get tested. And I think that that's an issue for us. We've just got to figure that out. Do we even want to go to the doctor? Mm-hmm. Have you made sure that since you're in COVID that you're going to go to the doctor, that you're going to continue to go? And for parents who have health issues, how is that going to affect their education, being able to support their children in their education? Because many people have those same issues, whether it's diabetes, whether it's other health issues that are affecting them as they're trying to parent and keep their health up. And then obviously the backbone of many homes, grandparents, aunts, uncles, surrogate moms and dads who clearly keep babies and have no clue how to tune into technology. What about those other surrogate parents who have that new responsibility? What do you see them doing right now? Dr. Brown.
Well, it's that multi-generational structure. It's leaning on everyone. We'll have families, multi-generational families, grandparents, children, children's children, all living in one home, sometimes sharing one bathroom. And so it's a health issue, because if any one of the family members becomes sick with COVID, how do you quarantine in a setting, that small? And this is a real issue for some of the impoverished neighborhoods that we have. And we can track it by zip codes. The surrogate mothers, it goes back to our upbringing. The neighbor down the street was your surrogate mother. It could be, someone from your church. So I think this is a time as a community where we all have to be a village to each other. Look at our community for support. Look at family members, extended family members for support. A lot of our frontline workers don't have the privilege of working from home. And so they can't work remotely. They have to go out and put themselves at risk every day to have an income. And so that is another issue that really causes a family strain on the frontline workers who have to leave the household to provide an income to the families. So community support is paramount.
Dr. Davon?
I don't think I can add much more to what Dr. Brown said. I think she's absolutely right that we're a village and we have to lean on each other. And there are, and as we're in the midst of this pandemic, we have to be concerned about our health, other people's health, and how do we survive? How do we come together? I think one challenge for people that have younger people in the family is the sort of the movement back and forth, in and out. I know that a lot of children are suffering from having to be inside, having to shelter in place for a long time, and feeling the need to connect with other people. But that's risky. That's risky behavior. And so it's a challenge to help people recognize, young people in particular, recognize the importance of staying home as a strategy that will save your life. There will be time enough after we're done with this virus for people to go out. But when children are going out and there are multiple generations in the home, they're potentially infecting other family members, and it could be fairly dangerous.
What are the pros and cons of in-person learning versus virtual? I think Dr. Gloster, you got that going on.
I do. Again, in a hybrid space, I have my 2 children who will be participating in a virtual learning space. And so as a mom, I put on that hat, and I'm very sensitive to the needs of my 5-year-old, again, who's beginning kindergarten, right? And so it's interesting because, there are so many pros and cons, not just for the students, but, I really want to make sure that we also engage the teachers in this conversation too. And as our colleague just spoke about, this idea of some of the gaps that are existing and the PTSD that might be existing. One of my oldest daughters, her teachers visited our home over the summertime and gave a care package just to say, we're thinking of you, we miss you, we want you to have a good summer, because they didn't get a chance to give their students a hug and wish them off. And, so those type of pieces, just those real life physical connections that our teachers experience, that they're able to love on our students and our children in a very special way. Those are the pieces that are missing, right? And so as I think about even my own 5-year-old beginning kindergarten, how will our teachers make connections with her about, what's her favorite color? What makes her smile? What are her strengths, right? And so there are a lot of opportunities that might be missed, but likewise, there's a lot of opportunities in this space. I don't want us to focus on the deficit of not being in person per se, because we're still prioritizing the work. And the work is providing the best education for our students. And so I think one of the benefits of, online virtual learning is really allowing the opportunities for our students to make connections virtually, really, across schools. For example, I saw in one school district, um, they're allowing middle school students to take some high school courses virtually online. So that's an opportunity that might not be able to exist just by virtue of, schools not having the proximity to allow that to happen. So really extending those learning opportunities for our students in a different but unique way, I think is incredible. I also think because students will have equitable access for engaging in technology, they will be able to participate in research. They'll be able to engage each other, and participate in building connections in a very real world way. And so I'm excited about the possibilities that will occur in this virtual learning space. And so again, how do we continue to find the joy in the work? I don't want this to be like this morbid, we're in, virtual learning and it's very new and it's very different. How do we adapt? Change sometimes and oftentimes is fantastic. And I think this virtual learning opportunity, while it's something that blindsided us in many different ways, I think that it's a phenomenal opportunity for our students, for our teachers, our principals. Shout out to our principals who are really working hard, not just in our district, but I'm sure nationally, to really create positive working and learning environments for our students. So, while there are pros and cons, I think there are more opportunities than we have deficits. And so I'm certainly excited about the possibilities that are going to come out, and what we'll begin to see our teachers leveraging for our students.
Yeah. I don't know if I buy that, but
I do. I certainly do.
I'm just kidding. I mean, you have to approach it optimistically. I mean, you do not want to get depressed thinking about COVID anything.
Exactly.
You literally have to say, hey, it's about resetting. This is another way to approach learning. How can we find equality in this movement? How can this be a moment for us to understand that we have a new approach? So yeah, definitely always like Dr. Gloster, because in COVID, I'm all right. Y'all, the only people I see in my house is when I go on in Zoom, and I don't often Zoom except for on my morning show and now. So these are the only guests I get in my home. I'm not as open to people coming in and out, so I'm just can't bet on it.
Yep.
College and Dr. Brown and
well, we've had some challenges. This generation is going to be known as the COVID generation. And we tell our students all the time, 2020 is the year that changed everything. And so the challenges that we've experienced at the college level is that our professors had to pivot real quickly to go to online teaching. And so we had to really do intensive online training, get them certified. We call them Quality Matters certified to be able to teach online instruction. It was a steep learning curve, and it was a learning curve that had to be implemented quickly. As for the faculty as well as the students, we spent some monies. We've gotten some monies to provide these. Every faculty who needed a laptop got one. Students who needed laptops also were given the opportunity to get one. The challenges we saw were the students who had to return home to those rural communities where there wasn't Wi-Fi or adequate, that digital divide just was exacerbated, I should say, because of the technological deficits that were in their communities. research has shown that virtual education doesn't really take the place of real in-classroom space learning, but online learning can be just as effective if it's done right. And so it's got to be done right. It's not just about uploading content, in Moodle. It's about engaging the students in learning that content. Another concern that our parents, and I'm a parent, I've got a 18-year-old that's starting her first year as a freshman as well. And, things that parents struggle with, is there a significant amount of learning loss because they had to quickly go to this learning platform that they'd never experienced again before. And so the learning loss is really a concern of parents, particularly for those students who were low achievers in comparison to students who may have been high achievers. Is that gap going to widen? And so that's something we've not seen yet. We cannot measure that yet, but there is a concern about parents with learning loss as it relates to math and English K through 12. At the college level, some of the other challenges we're facing is the social isolation. Kids go to college, it's their freshman year, and they're not able to engage and take full advantage, of the band. Here at Southern, our band is everything. Football is everything. And so I really, really think that the lack of that type of interaction and engagement, at the collegiate level is going to have some type of effect. I kind of frame it in the context of, with my kids, because I have to be optimistic, this is going to be a post-traumatic growth for you. Let's look at it that way. Out of this adversity, you are going to grow. You're going to value life more. And when you can engage in those activities, you'll embrace it all the more. So mentally, everybody on this, but we've got to leverage the positiveness just to negate. There's so much negativity just to survive in this unprecedented time.
Dr. Devine, any pros and cons on one thing, just one?
I think there's a lot of innovation that's going to take place when we think about people of necessity having to shelter in place, that new businesses will develop, new ways of learning, new opportunities. I volunteer with an organization, a startup company that is doing mental health counseling online and for African Americans. And so this will be an opportunity when we think about the number of African Americans that are less receptive to addressing mental health issues, and that you have the safety and the security and the privacy to conduct counseling in your own home. You're not going out where you may be concerned about who may see you, but you're able to get your mental health needs met. I think this will be an opportunity for many businesses to grow and to flourish and to think about possibilities that we would not have considered outside of COVID-19.
Sounds like a business proposition for anybody that wants to come up and get up and fill in the gap. I think innovation is key. Mm-hmm. Every parent's going to have to figure out, how do you innovate your approach to your child's learning? I think the adoption, though, of technology is something that is a little bit concerning. Like, how will you adopt as a parent to doing research? And most parents hover over their children when they're at college, but this is a moment where you really gotta monitor behavior, friends, social, just to kind of get a grip on your babies being away. When we think about this, what advice do you have for parents in just helping to test the mental, your child's away first time? How do you just kind of give them some questions on being away, coping, controlling, knowing that you're at college, but not kind of really? You're at college and you really may not want to start your first love affair at that moment during college. You might just want to have some friends. So what advice do you have? Because I think we just really got to share some insight for parents whose babies are literally trusting that Southern has figured out those who are going to test their freedom, because that's half of college. How can you manage yourself during this moment that you're away? And we know that many fail in that experience. Not to be negative, but I think we need to give some insight. I've learned so many beautiful words from you all. Low wealth. So I stole that. All of you don't call anybody else poor. It's low wealth. So increase your IQ. And Dr. Brown, you said it was distance something, low distance. What was it, Dr. Brown?
Was that? I
You
don't know.
said,
So much I don't even remember.
y'all got to cool out and give me these gems. Because, see, I start bragging with my friends. I tell them I talk to all these doctors, and I love low wealth. So everybody's wealthy. You just have a little lower than the other, a little mid, high. But it was something about low learning or low distance, those that were low learners versus the high learners.
Oh, yes. The low achieving students and high achieving students.
Mm-hmm.
It was a low distance. It was something really brilliant you said. That's okay. I'm gonna watch the tape again and see what it was. Because I like all these keywords that make me. I'm not getting a PhD anytime soon. I'm not getting a MD anytime soon. But I love being around smart people, and we are definitely in the moment of strong sisters. This is the moment. I am so excited about leadership. But for me, what would you say as parents? How can we support our young people, but really stay a lot closer to them than we've ever been before? And also checking in on their mental, because this can be, a lot of people get rejection during college, and they're not necessarily can't make friends the same way. How do we check in on their mental, their emotional development while they're at college as well? And we can open it up for questions for anybody who wants to put questions in the chat or on Facebook. Dr. Brown?
Well, I think the key here is two things. One, to empower our children with knowledge and with the right message. Because early on, you all knew the messenger, our leader, was not giving factual messaging. And I think that caused a lot of confusion as to who this virus was going to impact, how it was going to impact. And we lost a lot of valuable time and lost a lot of valuable lives because the message wasn't accurate and the messenger wasn't believable. So I think it's twofolded. You have to have the right message, a truthful message, a believable message, and a relatable message. Right now, we're doing all sorts of campaigns where we are targeting youths and how to wear a mask properly, so that it covers the nose, the mouth, not hanging on the chin or below the nose. So we've done a lot of educational campaign about just how to wear a mask and good hand washing, social distancing, those kinds of things. So the best you could do is the best you could do, and that is to educate our youth and educate the elderly and dispel any myths. Secondly, is to stay connected. With my own daughter who, didn't get to graduate, didn't get to go to prom, missed out on a lot of activities. I saw a change in her. She, became somewhat withdrawn. But it was my goal. I was just in her face every day and stayed connected and picking up on cues and trying to focus on what you have or what your gains are and minimize the losses. Because we've all lost, we've lost lives. And then when I put it in that perspective, that the loss of a life is far more valuable than missing these, high school activities, even though in the moment they're valuable to you, there's no price for a loss of a life. And so I think it's that kind of, messages that we have to get out and empowering our students with knowledge and the right message.
Dr. Davine, you have a baby girl going.
I do. Fortunately, she's at home this semester. Her institution is open right now, but she's at home just because we had concerns about how things may unfold. Um, One of the things that, much like Dr. Brown was talking about, the constant communication is important because I noticed the same thing with my daughter, much more withdrawn. But the fear and anxiety about what was going to happen, like, is this the end of the world? Is the world getting ready to come to an end? And so really having to manage those irrational thoughts with logic, with the fact that we've had challenges before, maybe not like this, but we're going to manage. You just, sort of keep doing what you need to do and have faith that things are going to get better. But just open communication. One of the things that we've spent more time together, because we're not rushing all around, but we've been doing puzzles. And these thousand, I'm not crazy about the puzzles, but the 1,000-piece puzzles, we're struggling. It's not anywhere near done. But just the opportunity to sit down and communicate. There's so much you learn from your child when you have an opportunity to turn the TV off. And because after a while, even if you have 1,000 channels, there's really nothing still to watch, right? So that kind of communication, playing games, but the issue is around staying connected, but also around communicating, so that you alleviate the anxiety that children may have, and you get to find out what their concerns are so you can put it in perspective, because sometimes they're listening to messages that may be incorrect, completely incorrect. One of the things I talked to her about, and I teach about this in class, is in 1962, Greer and Cobb wrote a book called Black Rage, and one of their psychiatrists, and one of the major takeaways for me from that book was this notion of healthy paranoia. And when we think about paranoia, ordinarily we think about somebody being out of touch with reality. We think about somebody sort of not focusing, being sort of highly paranoid, and sort of struggling to manage. In any case, when we think about paranoia from a medical perspective or diagnostic perspective, we see that as pathological. But they talked about a healthy paranoia, given the volume of anti-Blackness, racism, discrimination that people in this country experience as African Americans, that not being concerned about your safety and your well-being could be lethal, could be life-threatening. So when we see the barrage of misinformation, take hydrochloroquine, take your zinc and your Z-Pak, and the virus is going to disappear. If you're not a thinking person, you may buy into that myth. And if you recall, when we first had COVID, we were told that African Americans couldn't get sick. We couldn't get sick. We were immune to the disease. By the way, that's the same thing we were told in slavery, that we were immune to yellow fever because we came from tropical climates. We were not susceptible to yellow fever. But when they've compiled the data more recently, they have found that African Americans, Native Americans, and whites were equally susceptible. But if you tell somebody that they're not immune, you can get them to go out and spend more money. You can get them, to take risks that may be dangerous. So one of the things I talk to my daughter about is healthy paranoia. Think. You can't just take someone's judgment. You can't be gullible. You have to think for yourself and think things all the way through.
Well, we'd like to thank the AARP Black Caucus Employee Research Group, the HBCU Alumni Outreach Committee for helping to raise this conversation for students and families returning to this academic year. I just wanted to get that in and thank AARP, a real resource for those who don't know, can't afford. Their advocacy and education and just dealing with health in general is there. Had another question for you, doctors, as we're coming to a close. If you were going to give a speech and you were going to talk about skill sets that you can acquire during this moment while you're at home as a parent, what would those skill sets be? Okay, doctor, everybody has 3 minutes, just so that we know. Doctor, my favorite, Me. No, just kidding. You're all my favorites. I have to stay light. Like I said, you're the only guest I'm going to have this week at my house. Dr. Gloster.
Yep. I think that there 3 minutes, right? I think that there are a myriad of skills that we can acquire during this time. I think our colleagues talked a lot about that. Really taking time out to just pause and take time to listen to our kids.
Dr. Gloster, we're going to really get it down to 3.
I'm gonna be quick. I promise.
I'm just kidding with you, Dr. Gloster. But I know I ask unwitting questions that are not there, but I'm really thinking about learning a Spanish, another language. I'm really thinking about
that's a possibility.
You know what I mean? Like I'm really thinking kind of like the puzzle, but if our kids learned another language during COVID, it would change the game.
That's certainly a possibility, right? As we are expanding our resources, learning a different language would be fantastic. I think another thing that would be incredible for our students, kind of thinking about critical thinking, collaboration, is coding. As we're thinking about this idea of STEM and STEAM, science, technology, engineering, arts, and mathematics, coding is my daughter, a lot of our students, they're all on TikTok. They love this TikTok moment, right? So how do we leverage them to begin thinking as entrepreneurs and using that skill set through coding to then build their own brand, which is another skill they could be thinking about. What excites them, and then how can they use their hedgehog, if you will, something they're good at, something they do better than anyone else in this universe, and something that they're passionate about to build a brand. So I think those are kind of 3 areas that they could think about during this time. But I do still strongly believe take this time to talk to your kids. No one's talking about what it is that they need during this time. So ask them. I think we need to hear their voice as well in this conversation.
All right. So two-way communication definitely is key, but I think that's been key. I think that we want to hear more now. We've learned that much, just talking to, listen to me may not be the approach anymore, especially since I've been in the house with you for the last 200 days. You might not want to talk to me that way anymore. Dr. Davine.
Well, I do. I love what Dr. Gloster said in terms of learning skills and coding. I think that's important. Engaging in activities. I know my daughter has started making videos, like makeup videos, because that's something that she's really interested in. And she's also she played the violin in middle school, elementary, middle school, and so she's picked that up. So boredom sort of causes you to do a lot of things you might not do. She bought a guitar and she's twiddling with that. So sort of trying new skills, new activities that will sort of take you in new directions. The other thing I want to say is I don't think we can minimize, for people who are members of a faith community, the importance of faith, because that can be a strong anchor. And one of the things that we know is that having a faith system, whether it's organized religion or spirituality, can help reduce mental health kinds of concerns.
All right. Dr. Brown?
Yeah, I was going to echo all of what they said. I think speaking from my own family, our faith has gotten us through some of the darkest days. So I think that, anything that we can do to enhance that, build it, enrich it is phenomenal. We've done, some watching our favorite, ministers, podcasts and during this time. So that has helped. Learning how to play a new instrument has helped. And getting, believe it or not, taking advantage of this online learning. For, folks who are working, this is an opportune time to get a college degree, because you can do it at your own pace, at your own time. So I think we're going to see a rise in people getting second degrees, or in individuals who are going to be able to get their degree while working, because they won't be confined by the barriers of coming to school to get the degree.
May I add one more thing?
No. You know your brother's just kidding, Dr.
I know you are. I think gratitude is important, that every morning we need to wake up and you know, there's a lot that we've lost, but there's a lot that we have to be thankful for. So every morning when I get up, you know, if I can say it, thank you, Jesus, thank you for letting me wake up, for not having to be in a line where I have to, you know, scour for food, that I still have a job, that, you know, I'm not impacted by COVID. You know, being thankful about the small things that we have becomes really important, because it allows you to take other things, the things that seem to be overwhelming, in stride.
I love that attitude of gratitude each and every day. So, you know, you don't have to question what if. You just know that you woke up and you got a fresh start each and every day. Dr. Glover, I was really more on second language is high for me, because I think our community needs to understand, as they talk about going from Black to brown, there will be a lot of brown people speaking a second or third language. So I think that families that can do it. The other thing is creative writing. I think the journaling during this moment, we should be able to read a ton of journals, whether you do an audio journal. I like graphics for our children, so that if you don't like coding, Canva is really inexpensive learning tool. Canva Pro is $10. The whole house can use it. So I think acquiring skills that our children will actually get paid from, I think is even more critical. I love the musician, but I think learning the piano is probably the easiest, because you don't always have to have it. But, you know, somebody will hire a piano player for their wedding or just to entertain, but acquire a skill set. I think if we encourage all of our children to acquire a skill set, I think is key. But the journaling, just so that their history isn't lost. And I think having companions like mother-daughter, mother-son, just you write on a page, I write on a page, just to talk about our gratitude, or what we didn't like that happened, that we both saw that we didn't like, that we can make better, so that we can look back and read the history of our community. Because I think we have to entomb our history as much, and be able to write those stories and be able to talk about how we made it through, and how I spent 6 months watching you grow, and just being at that point, we can share that history. I saw you turn from 5 to 6, and I can talk about your first year. And the other thing is just helping them understand, unlike many generations, that, you know, emotions go up and down every day, and it will be a ride for the rest of your life. So being able to understand and talking in a mental health language, so that they learn more emotional language. We weren't necessarily given a ton of emotional language, but I think at this moment we can get between, if you're feeling lonely, if you're feeling, we can share emotional language with our young people and with families. And many people are hungry, and being able to figure out how to do outreach and do something for somebody else, pass something forward, because there's definitely somebody, given you got 43 million people unemployed, you have somebody in need. So I'd just like to thank you all for all that you've given. You got no minutes left. And I've had a wonderful time. I've hung out with the most intelligent, brilliant women of this time to talk about education and COVID, and how we can love and raise the health IQ of our community. So I want to thank Dr. Sandra Brown, Dr. Gloster, Dr. Dave Vines, for all of your contributions here, rolling out Health IQ, and thanks to AARP. So have a wonderful, wonderful day. Be sure to email Portia, the producer, and I'll send you my new project, which is a women's coloring book with meaningful statements, so that you can do it. And it has wonderful things you can draw and fill out. And I'll send one to each of you, so you can spend a little bit of time and color while you've got so much to do. And Dr. Gloster, you know I write children's books, so go to playforgenius.co and I'll send something to your 5-year-old. But I'll definitely send you guys one of the coloring books. It's 100 pages, great looking, meaningful statements, something to keep you entertained during this moment. So from me to you, I'm Munson Steed, and this has been Health IQ. We thank you. Be sure to increase your health IQ every day. Love yourself first. You do not have to be in the streets, but you do have to be in this struggle for all of us to get better and be better. Thank you. I'm Munson Steve for Health IQ on Rolling Out. Peace.
Thank you.
Thank you.
Thank you.
See, be sure